name is Siobhan O'Dea and I'm manager of the Gay Men's Health Service. The Gay Men's Health Service is the only national STI service for gay and bisexual men and men who have sex with men and the trans population. The Gay Men's Health Service first opened its doors on the 6th of October 1992, so 25 years ago this year, and that was 9 months before decriminalisation of homosexuality, which was a very brave step. In that time, it has seen over 100,000 service users have come through its doors. It is a very popular service, and prior to our setting up of the nurse-led clinic on a Monday, we had services on a Tuesday and Wednesday evening only. These services were always in huge demand, with the result that we were turning away between 25 and 35 service users a week. Those were people who would attend in some occasions with symptoms, and we would have to turn them away, and they would either have to come back the following week or attend another service. The nurse-led clinic was born out of this need and the fact that we were turning so many people away. So we put in a proposal to Health and Wellbeing at the time to look for funding to start this service. They gave us funding to run the clinic and we trained up our staff. We supply a rapid HIV test and a full asymptomatic screen that is nurse-led. The clinic has now been running for 14 months. We've had over 1,400 service users at this point use the clinic. We have picked up a rate of STIs of 15% in the cohort that have attended. That's almost 1 in 6 people have been diagnosed with an STI. This is quite significant in that the clinic is specifically for people who have no symptoms. So the fact that we've picked up that many STIs means that we will ultimately have prevented transmission of those STIs to others in the community.
Sometimes it can be a little bit daunting going along to a sexual health service, particularly if you know that you have reason to need to go. But you know, when you do arrive, you will be looked after, and the conversations that you have with the staff here really do put your mind at ease. And it's such a quick turnaround in terms of results and stuff like that as well. You're in and out for an asymptomatic screen, including a rapid HIV test, where you leave with the result within about 20 minutes.
The Monday Clinics was surveyed, there was 500 odd surveys completed by attendees, and 98% of people that had used our Monday Clinic service were extremely satisfied with the service we provide here, and of course that's always great to hear.
Our dream would be to try and test and treat as many people as possible for STIs, ultimately prevent transmission to others within the community, normalise STI and HIV testing, and make people feel comfortable about taking responsibility for their sexual health and not make them feel like it's something that they should be ashamed of.